going towards the investigations of diarrhea, that what investigations we should do for diarrhea. So number first, stool analysis. Stool examination is performed for what? For fecal leukocytes, but it is always present in which bacteria? In Shigella, Campylobacter, Enterovasive E. coli. Even in ulcerative colitis, patient has focal leukocytes, and in Crohn's disease. Variable in Salmonella and Clostridium difficile, but it is almost in absent in rotavirus, Giardia, and amoeba, Cryptosporium, E. coli. Food poisoning due to Staphylococcus, Bacillus cereus, and Clostridium perfringens. Now, basically, there is ova parasites, and also Clostridium difficile toxins are also present. Then you will do actually stool culture in the bloody diarrhea. Serum electrolytes very important in diarrhea. Serum urea and creatine level you will check, and sigmoidoscopy if ulcerative colitis is suspected. What is the management? First of all, your outline for management: diet, hydration, antidiarrheal agents, antibiotic therapy. So in diarrhea, you will tell the patient to eat the soft foods. Okay, the foods like that are like soups. Okay, drinks. Okay, fruit juices, cold drinks you will encourage, but you should avoid it. Rest bowl by high fiber diet. You will avoiding matlab you will not have a high fiber diet. Fats or milk products, caffeine, alcohol. Your diet should be soft. In in rehydration, very famous is ORS, oral rehydration solution, which is very inexpensive, cheap, but safe and highly effective in almost all cases. Okay, the fluid should be 50 to 200 ml per kg per day, depending on the hydration rate. The IV fluids should also be preferred in patient who has have severe dehydration, like normal saline or ringolactate, which is given to restore your electrolyte and water balance. Distressed water should be avoided. Antidiarrheal agents with the mild or moderate diarrhea will improve the patient's comfort, but should it be used in patient who has bloody diarrhea, high fever, or systematic toxicity for worsening the disease? You have lepromide, which is also amodine, very famous. Amodine 2 mg is preferred with the dosage of 4 mg initially, followed by 2 mg after each dose, after each loose stool, maximum 16 mg per 24 hours. In antibiotic therapy, you will give empirical treatment, because majority of patients has a mild self-limiting disease. Either it will due to the viruses or bacteria. So this treatment, what we will do, this treatment, antibiotic treatment of all patients with acute diarrhea is not recommended. Means you will not give in acute diarrhea. It should be given in patient with incisive diarrhea, means the patient will have fever. And tenesmus means that you have the feeling of fullness of bowel, but your bowel is actually empty. The patient has a bloody stool, presence of fecal leukocytes, and stool bacteria culture is in process. Means you will give impaired treatment when the patient has a fever, tenesmus, and bloody stool. But antidiarrheal agents are not given in this case, remember. The drug of choice is quinolone, such as ciprofloxacin, very famous, 500 mg twice daily for 5 to 7 days, and metronidazole, which is actually flagyl, which you will give 250 to 500 4 times daily, may be given if giardia is suspected, because it may be negative in stools of 50% of infected patients. Okay.